2023, presented by the Lupus Foundation of Northern California. My name is Tom Bakewell. I joined LFNC in February of this year as the Executive Director. This organization is such an honor to work with, and we are excited to welcome each of you back to our free Lupus Health Conference. We have two great sessions planned for today, but first we'd like to thank GSK for being the sponsor of today's health conference. We're planning another great conference that will be on August 19th. Mark your calendars now, as we have Dr. Rekha Mankad, an assistant professor of medicine in the Division of Cardiovascular Diseases and the director of the Women's Heart Clinic at Mayo Clinic in Rochester, Minnesota, scheduled to speak, followed by a workout with Reagan Burr of Reagan Moves. You can sign up for that conference today, and more information is available on our website, lfnc.org/events. Also, don't miss out on our early bird pricing for our 29th annual Outrun Lupus 5K on Saturday, September 23rd, 2023 at Campbell Park. You can sign up now. This will also be a hybrid event, so you can join us from wherever you live in Northern California or beyond. Start thinking about forming a team and help us outrun lupus. Go to our website in the events section to find out more details. Finally, we want to hear your thoughts on this conference, so please be sure to complete the survey when the webinar ends. This is the only way we can hear what you liked and any suggestions of what you'd like to see in the future. Thank you and enjoy the conference.
Good morning, everyone, and thank you for joining us for the health conference today. I'm Lori Day, and I will be your moderator this morning. I'm the communications director at the LFNC, and I'm excited to be with you. So we have a packed schedule today, so we go over the agenda really quickly, and then we will get started. The first session, we will begin with a presentation from Tatiana Spiegler, the Patient Engagement Liaison representing GSK, followed by Dr. Gaurav Gulati from UC Davis. Dr. Gulati will discuss finding common ground, patient and physician perspectives in lupus. After his presentation, we will have 15 minutes of live Q&A. We'll be moderating the questions, so if you have a question during the presentation, feel free to type it into your Q&A section, and we'll ask them all at the end. Our second session, we will host our first patient panel of 2023, which we're really excited about. We're welcoming 3 lupus warriors, and they will discuss their lupus journeys and then answer some questions that you may have. After the patient panel, we're excited to welcome another new presenter, nutritionist Tanya B. Freirich. Tanya will present the many plates of lupus, diet and lupus, and we'll have a Q&A session after her presentation as well. So I'm pleased to start our first presentation from Tatiana Spiegler, the Patient Engagement Liaison representing GSK. Tatiana wasn't able to join us live today, so she has sent a pre-recorded video. So we won't be answering any live questions, but feel free to type any questions you might have and we can get them to her and get your answers to you. Also, at the end of the video, there will be a QR code, and I'll type in a website for you. Feel free to go to that website. They've got a lot of great, useful patient information for you. Okay, so let me start by playing Tatiana's video. 1 second.
Hello, everyone, and welcome. I'm Tatiana Spiegler. I'm a master's prepared registered nurse with 10 years of diverse nursing experience, and I'm a patient engagement liaison representing GSK. Today's presentation is very important, as we'll talk about biologics as an add-on form of lupus treatment. And choosing to learn more about treatment options is a sign that you are being proactive in managing your lupus. And remember, this presentation does not take the place of talking with a doctor. And here are main areas we'll cover, starting with some basics of understanding lupus, especially how lupus affects the immune system. Then we'll take what we learned and talk about common treatment options of lupus and treatment goals. And then we'll get into biologics. We'll go through what they are and what makes them different from other treatments. And the last thing we'll talk about is details around what to expect if you and your doctor decide to start a biologic and what that process may look like. And this presentation may spark some questions about your own treatments of lupus. So I advise that you write them down and you share them with your doctor during your next visit. And let's go over the basics of lupus to get a better understanding of how lupus affects the body. The first thing is that lupus is considered an autoimmune disease. Normally, the immune system protects our bodies from viruses, bacteria, and other germs by creating antibodies. And in the case of an autoimmune disease, the immune system creates autoantibodies that mistakes the body's own healthy tissues as invaders. These autoantibodies cause inflammation, pain, and if not controlled, can damage various body parts. The second thing to understand about lupus is that it's a chronic illness. This means that there is no cure, but there are treatments and lifestyle changes that can help control lupus. Symptoms of lupus come and go in periods of flares and remissions. A flare is when lupus is very active in the body and the symptoms are not controlled. And remission is when the person may feel better and lupus symptoms may be well controlled and mild. And lupus can affect any body part, as we can see here on this slide. The signs and symptoms of lupus can affect any area or organ with varying levels of severity. Some of these symptoms are visible on the outside of the body, while others are inside of the body and only can be recognized by you and your doctor. Any of these symptoms may mean that your lupus is active, and your doctor may request lab work or further testing to assess your organs. Leaving lupus untreated and uncontrolled can lead to organ damage. And in addition to disease activity, daily steroid use could put you at risk. So it's important to discuss treatment options with your doctor to minimize the long-term damage. And right now, there's no cure for lupus. Symptoms may come and go, like I mentioned earlier, making lupus a chronic condition that needs a lifelong management. It's a long-term disease that requires long-term treatment. That means that you need to commit to a treatment plan with medications and lifestyle changes that will help you manage the long-term effects of lupus. And when you're talking with your doctor about your treatment plan, I want you to consider the long-term effects of lupus, like the effects of the treatment that you're on, or the damage from lupus-related inflammation. And don't forget treatment goals, because these need to be unique to your wants and your needs. Now let's take a closer look at common lupus medicines. Having a bit more background about all of this can help you get a better understanding of biologics as an option. Let's start with antimalarials. They're commonly recommended to control autoantibody activity by reducing your body's production of autoantibodies. Those were the antibodies I mentioned earlier that destroy the body's own healthy cells. Steroids are often used to quickly treat lupus-related inflammation during a flare. Immunosuppressants work to suppress or change the immune system to help reduce the disease activity and flares. These treatments I just mentioned are made from chemical compounds, while biologics represent a completely different type of treatment. They're made from proteins and antibodies from living organisms and are designed to focus on very specific proteins in the immune system to help reduce and inhibit your immune system's attacks on the body. Biologics are a different class of medications used in the treatment of lupus as an add-on to the common treatments, like I mentioned earlier, the antimalarials, the steroids, and the immunosuppressants. And different treatments may be recommended because they may work differently according to your own lupus. So it's important to talk to your doctor to learn more about treatment options. And you and your doctor may have some of the same goals in mind. So be sure to check with your doctor and share your goals occasionally. Sharing what's important to you can help you and your doctor decide what's the best treatment plan for you. And some common goals of treatment include controlling the disease activity that leads to inflammation, proactively treating and preventing severe flares, protecting your organs from damage, controlling side effects for medications, and improving your overall quality of life. Another important goal that we have here is shared decision-making in partnership with your doctor. And keep in mind that your goals may depend on your age, your symptoms, your overall health, your lifestyle, and how lupus has progressed. After learning about biologics as one of the treatment options, think about your personal treatment goals. You and your doctor should work towards a treatment plan that works long-term for you. Prioritize your treatment and what's most important to you, like minimizing steroid use, controlling lupus activity and those damaging flares, and protecting your body from organ damage. Now let's talk about biologics. Biologics are created using proteins and antibodies from a living organism. They're designed to target a very specific part of the immune system to help manage your lupus and the immune system's attacks on the body. Biologics have been around for a while, and they're used to treat a variety of diseases, including lupus, where they work to manage the disease activity. A biologic may be prescribed as an add-on treatment to existing medications. It's not prescribed alone. So talk to your doctor to see if adding a biologic to your treatment plan is appropriate for you. More specifics about how biologics work in treating and managing lupus. Biologics are designed to have an effect on very specific pathways in the immune system. Some blood protein signals that stimulate B cells, while others focus on the specific proteins on the surface of the B cells. By blocking these proteins that trigger the immune system, biologics can help reduce and manage inflammation. Reducing inflammation can lead to reduction in disease activity, flares, and the need for steroids. Typical immunosuppressants weaken the immune system, and biologics may also weaken the immune system. However, they focus on different pathways within the immune system to help manage lupus disease activity. And if you're concerned about side effects, be sure to talk to your doctor about it. And remember that flares are still possible with a biologic, and you can work with your doctor to manage your treatment plan. And now that we covered some basics of biologics, I want to shift gears a bit and talk about how to apply what we just learned to your day-to-day lupus management. So when is it the right time to consider a biologic for a patient? And there are general treatment guidelines that give doctors a good idea of when a patient may be right for biologics. But if any of the following statements resonate with you, it may be a good time to talk to your doctor about adding a biologic to your treatment plan. If you're taking lupus medicines and you're still having symptoms, if you're taking your lupus medicines and you want to reduce steroid dose, ongoing disease activity and frequent flares may be a sign that it's time for a treatment plan change. And remember, your treatment is about you and your life. So make sure that you speak to your doctor if you identified with one or more of these statements. And to prepare for a conversation with your doctor about biologics, be sure you track your latest symptoms and think about how lupus has impacted your life. Make a list of all of your treatment goals and your questions and bring them with you to your appointment. Remember, you can also have an appointment buddy with you to take notes or keep track of the questions. And before you go, practice what you want to say. And this may sound a little silly, but it will help you make the best of your time during that appointment. You can also ask to schedule an appointment with your provider's biologic coordinator or nurse to review the treatment schedule and walk through any questions you may have. And as with any medication, it's important to take biologics as prescribed. If your doctor prescribed a biologic, make a commitment to yourself to take the medicine. Remember that it may take time before you notice changes after you start a biologic. And each biologic has its own dosing schedule and may take time for it to start working. And if your doctor prescribes a biologic, make a commitment to yourself to take the medicine as the doctor is telling you, as it was prescribed. Talk to your doctor about what to expect. Get an understanding of how you and your doctor will periodically check in on your process. Ask about logging your symptoms and what routine tests you should plan for. Make sure that you know how often you should check in with your doctor for updates and appointments, and have a plan to communicate with your doctor in case you have any side effects. The process behind finance and insurance may look different for different prescriptions, but they should not be a barrier. There are many resources, tips, and programs available to patients who take biologics. Make sure you're open with your healthcare team and you ask them questions about cost and what options may be available for your treatment. It's also important that you understand health insurance coverage, including medical benefits and pharmacy benefits. You can always review your summary of benefits to get more details on specialty medications like a biologic and working with a specialty pharmacy. Now, biologics come from specialty pharmacies, not the pharmacy that's in your neighborhood. And these specialty pharmacies call the patients once the doctor has put in the prescription for a biologic. And if the person doesn't answer that call, the pharmacy cannot fill the prescription and the person won't get a biologic to start their treatment. So if you and your doctor decide that a biologic is a good add-on to your lupus treatment plan, make sure you answer their call, even if you don't recognize their number. And if you haven't gotten a call after your doctor gave you a prescription for a biologic, you can call their office and ask for help. And to help review what we talked about today and continue learning more, I have this QR code. It will take you to the Ask in Lupus website. So go ahead and use your cell phone's camera to scan the code. And you can get access to free resources and learn about different treatment options. Thank you so much for sticking with me until the end of this presentation, and come see more webinars at gskplacehub.com.
Okay, hopefully you guys have had time to scan that QR code. And I will also put the website on the chat area for you. Thank you, Tatiana, even though you're not here. All right, thank you very much. Now I'm going to go ahead and introduce our next speaker, Dr. Gaurav Gulati from UC Davis. Dr. Gulati is a first-time presenter for us, and we're very excited to have him. He's an associate professor, Department of Medicine Clinic Director, Division of Rheumatology, Allergy, and Clinical Immunology at UC Davis. He's a board-certified rheumatologist offering care for lupus patients with autoimmune rheumatological conditions, including lupus, rheumatoid arthritis, and inflammatory myopathies. He will discuss finding common ground, patient and physician perspectives in lupus. Welcome, Dr. Gulati.
Thank you so much. And thank you to the Lupus Foundation of Northern California for the opportunity to speak with all of you. I'm most grateful to our lupus patients and their families who put their deep trust in the uncertainty that they go through with the lupus journey, and everybody's lupus journey is unique. So deeply appreciative of all the trust that they have put in me and our colleagues over the years. It's a great responsibility and we don't take it lightly. I'm also grateful to everybody here at LFNC, especially Maggie and Lori for helping work this out so seamlessly, and also the leadership here. Let me start by sharing my screen. Okay. All right, hopefully you can see my screen okay. And I will give you a little background on this talk. It's not a usual talk that physicians present. It doesn't have a lot of medication treatment options and therapy plans. I think this talk and the subject is more important than anything else that I have dealt with in lupus, and that is finding a connection between the patient and the physician. And what I'm going to try to do today is try to piece together perspectives on both sides and how you can gain the most through your physician visit, get your questions answered, and also stay safe with the devastating disease that lupus is. I don't have any conflicts of interest or any relevant disclosures. I do want to point out that the information that I'm going to talk about today is not meant as medical advice. You should always follow the advice of your physician, but I'm happy to answer any general questions you might have at the end also. So I want to start with a brief history of lupus. Lupus has been known for a long, long time, even before the 13th century. But looking over our records and collections, it was somewhere around the 13th century where the word lupus was noted to be used first. And as you know, in Latin, lupus stands for wolf. And that's the sort of disease, with the skin deformities, with the debilitation and findings that people saw lupus patients develop, like they were attacked by a wolf. And it was a pretty bad situation back then. There were no treatment options. There were no recommendations. Patients suffered throughout their course of lifetime with this disease. It was not until 1872 when the systemic nature of the disease was identified. Physicians started to understand that lupus is not merely a disease affecting the skin or certain organs, that it can really affect any part of our body and literally cause inflammation and damage to any organ system in the body. And that was, I think, a reasonable development in understanding the deeper aspects of lupus. The LE cell that led to a better understanding of how lupus was affecting patients and how the disease was slowly damaging our cells happened around 1948 when this LE cell was discovered. And then around 1954, a familial occurrence of lupus was formally documented, that there was a higher propensity for patients who had a family history of lupus, and there was a point towards a genetic basis of disease, which I'll touch upon a little bit later as well. But what has happened since then, since the 1950s? So before 1950s, the only really medicine of use we had was quinine and quinine-based products that continued to develop over the next 100 years. At the end of the century, salicylates came into the picture and started gaining some prevalence in use for mostly mitigating symptoms. And it was somewhere around the time when the family history of lupus gained emphasis that corticosteroids started being used for treatment of lupus. And we've come a long way in lupus itself. Overall, the survival has improved dramatically. Back in 1950s, there were only about 40% patients who were still alive at 5 years since diagnosis. And when we look at the data today, the 10-year survival with lupus has gone at 90% or even more. And that's mainly because of an earlier recognition, better understanding of the diagnosis, earlier institution of treatment, prompt recognition and treatment of complications or organ involvement that really prevents long-term comorbidities. So that has been a development. But lupus is a devastating disease for so many. I think the number exceeds the reported numbers here, and it affects the population in a skewed distribution. It affects women predominantly. That doesn't mean men cannot develop lupus. Lupus, in fact, can be more severe in men who do develop it. It affects people of color disproportionately more. It affects their daily livelihood. It affects their quality of life and impacts patients in so many ways that not only does it impact patients at an individual level, the financial impact of lupus as a disease is pretty high. And that is what is raising more concern, and lupus has thankfully gained more attention and people are working on this more. And that's just a reflection of how it negatively, in fact, impacts relationships, impacts daily responsibilities. It's the unpredictability of lupus itself. Of course, financial concerns, and really being able to have a good quality of life and enjoying life in general. 1 out of 4 patients that the Lupus Foundation of America saw were either temporarily or permanently disabled by the disease. And only about 1/3 of these patients were known to be employed full-time. So, you know, all the treatments that we've talked about or discussed with patients in the years are basically treatments to prevent the disease damaging the patient's organs more, trying to control the disease. We do not have a cure for lupus per se. So it's a disease that we really are desperately searching for a way to cure the disease, but we haven't really reached that point yet. Multiple factors contribute to developing lupus. It's a genetic background. I'll talk about it again in a little bit. socioeconomic, environmental factors that are very significant, modifiable biological factors or inflammation markers from the disease or from triggering factors. And really, the health system and quality of care, the health system is not created equally to address everybody's needs the same way or proportionate to their limitations. So that's a big factor that affects lupus and its outcomes. But it really goes through the channel of disease activity to disease damage and increased risk of long-term damage and mortality with lupus itself. And it has all these different effects that I talked about in patients' lives. So I see lupus as something that slowly, relentlessly withers away your quality of life, worsens ability to engage in different levels at different points in life. And it's really devastating for not only the patient, but also the families that are impacted and also people around them. So we don't know a lot about what causes lupus to start, but the general thought is that there is a trigger in the presence of a predisposed individual who might have a chance of developing lupus. And this is something from one of the articles we published, but it really talks about this triad of what we call genome, which is really our DNA genetic blueprint. Epigenome is really a broader concept of things that happen to the DNA over the course of time. And exposome, which is environmental exposures or triggers that can cause lupus-related issues. And it's this triad interaction of genome, the overlying epigenome, interacting with the environmental factors that is thought to contribute towards development of lupus. Some of the more common concerns are things like UV radiation, trace elements, and then there are some controversial elements like we talk about heavy metals, silica exposure, and others, but they've been known to be at least associated with, and some of them known to be triggers for development of lupus. As I've mentioned before, lupus can pretty much affect any organ system in our body, and that can go from things like headache symptoms or myalgias or arthralgias or joint pain or muscle aches, in other words, chest discomfort, to more severe issues like kidney inflammation and damage, heart inflammation and damage, damage to other organs in the body, rarely causing problems with the muscles or frequently causing problems with joints. So there is a distribution of the disease. Some organs are involved more often than others, but it can potentially involve any organ system. So it's a pretty broad disease, which is very difficult to navigate both for the clinician and the patient. And it creates a lot of confusion at times on whether this presenting symptom is lupus or not lupus. And that leads us to the cycle of events, the going from the physician to a treatment plan, to a follow-up, to managing the medications, dealing with lupus flares, and that can be very overwhelming. So that brings us to the important element here of what the provider looks at when you're looking at all the manifestations and the complexities of lupus, and how does a provider address them in the short time we have together as a physician and patient. The other side of the story is even more important, which is being able to communicate to the patient what is going on, why a certain treatment is being recommended, what are the anticipated positive outcomes from it, and what are the risks and other concerns from it. So the key element in better managing lupus is bridging this gap. And there is a very important element of continuing this communication process between your physician and the patient. Bridging the gap has some important elements. It starts with understanding the disease, having a very good hold on what lupus means to the patient and what lupus means in terms of what it can do and what it's already doing. In addition to that, prioritizing these things that are happening to somebody. What is important to the patient? It's very relevant. The patient might have things that are more important and more quality of life altering than potentially serious issues that the physician might think. And I think they're both equally important elements to consider. So what is important to you as the patient? And what are the serious issues that the provider is able to identify? And if we try to lean more towards one of these, then we neglect the other side of the story. So key is be prepared for your physician visit, and we'll talk a little bit about that, and then deciding on investigation and treatments. So the visit, really, a lot of these points I'm going to discuss come from patients who've dealt with lupus over the years, and I've seen them because of my area of interest being lupus. I always recommend patients to write down questions and concerns, bring them to the provider, but keeping these questions and the discussion very focused, trying to find ways to address these questions over time. And it might need more than a single visit, but trying to address things by prioritizing what you want to know most importantly and what the provider might have to tell you about seriousness of the disease. Sometimes it's helpful to bring a friend or family member along who can add to the information. One of the common things we see with lupus is cognitive change, or what some of my patients call brain fog. And that can be very limiting in being able to express yourself, ask the right questions, and sort of express the severity with which some things might be affecting you. And having somebody else as a not only as an advocate, but also as somebody who can help communicate for you is sometimes very helpful. I would always recommend patients to see if there is something that is on the after visit summary. I always share my notes with our patients, so you can always look at that and see what the doctor is trying to say. Know how to contact the provider to set up a follow-up visit, to discuss decision-making about medications or other things. And there are some resources we don't really use as effectively as we should. And those are other points of contact in the health system. And they include the nurses we interact with or discuss over phone, the medical assistant who's helping you get roomed in and talk about your medication and things. And when you go to the pharmacy to pick up the medicine, there are a lot of the questions that you might have in follow-up or before the visit that can be addressed through these resources. I would recommend using these resources and questioning, asking to get some of your questions clarified. I really like this thing called Ask Me 3. This is a concept that is available online. It's belongs to the Institute for Healthcare Improvement, which is one of the key quality improvement organizations here in the United States. And it encourages patients to consider 3 questions about the disease or question the issue under consideration. And those 3 questions are: what is my main problem? What do I need to do about it? And why is it important for me to do this? So joints hurt, I take prednisone. Why do I need other medications for this? Why is it important to not be on something like prednisone long-term and try some of these other medications? What are the risks and benefits, and what is the importance that it brings? So this is a good resource. I would highly encourage you to think about this, and it also helps you focus on your problem and be able to get your questions addressed through your physician. The objectives in lupus are really being able to keep it quiet, right? Quiet in terms of how you perceive lupus from a symptom standpoint, quiet in terms of how the physician can assess it in terms of physical exam findings and other details on your assessment, and then blood work and imaging and other modalities that might sometimes help you. It doesn't always help, but sometimes might help understand whether you're truly in a quiet lupus state or not. The other objective of this whole treatment plan is to prevent these flares. Flare is like an insult to the body. Anytime you go through a flare, it is getting you a step closer to the organ damage that we talked about. And we want to avoid that at all costs. Secondly, a flare can be as low risk as having a skin rash that disappears in a few days or a few weeks, or as life-threatening as involving the brain or other organ systems in the body. And there's no way to predict how bad the flare would end up being. So these are the two big objectives that help in preventing progression of of organ damage, of finding a safe and effective therapy to address this based on our objectives and goals. And then the most important element is to improve quality of life. When I speak with some of our patients, I always talk about the goal of treatment. You're taking all these medicines, you're dealing with things that involve lupus and also elements beyond the traditional inflammatory part of lupus, which can be pain, which can be discomfort, which can be depression. It's a chronic disease. It's not easy to live with it. So the goal of treatment is not simply to achieve a quiet state for the lupus as a disease, but also to improve quality of life. And I think that's very important to understand. Anytime we make a decision, the goal is to try to find ways in which our overall well-being from lupus will be positively impacted. The challenges to lupus, there are multifold challenges. I just mentioned a few here, but the biggest challenge is, how do I measure quality of life? What is quality of life for me as a patient? And that depends on what you like to do in your free time, what you like to do for your daily living, what is your employment like. It also means what do you do with life in general? How does it affect your relationship with others? How does it affect your ability to engage with the rest of the world? And that is important to continue to feel well with lupus. If you are doing well, taking 6 pills a day, seeing your physician every few months or at whatever time period, but you're feeling depressed or you're feeling like you're in chronic pain, the medicine's helping to a certain level, but it's not a complete care. So do you need to seek help from your primary care, or do you need to see somebody like a pain specialist, or other ways, seeing a psychiatrist to discuss some of these additional issues? But the key challenge is, how do I measure quality of life? And that comes from the patient. That comes from the person who's dealing with these symptoms on a daily basis. Nobody can know more about the quality of life element of lupus than the patient themselves. So I always encourage patients to report their lupus symptoms, but also discuss what's called beyond lupus, which is all of these other elements I discussed. Disease activity, of course, we have some measures to talk about it. It still remains a relatively incompletely understood disease. So sometimes disease activity may not be as easy to predict. And that goes into the clinical world. And that falls in the spectrum of what your physician feels and how it correlates with the rest of your symptoms. We're also desperately looking for early markers of organ damage. I've done some work with some of our colleagues on identifying early markers of lupus nephritis, finding markers for cognitive changes and the brain fog that we've talked about. And it's been challenging. We're making some progress, but it continues to remain a challenging issue. And then the other question is treatment options. Now, there's not a single treatment option that doesn't have associated side effects, associated lifestyle changes or alterations. Even taking a pill once a day that has minimal side effects is an intervention, and it does impact your daily life. You wake up with this idea that you're going to take a pill. It's not an easy process to get used to. So it is a stressor. And these treatment options, going from certain medications that you take by mouth all the way to medications that you take as injections or infusions, have their own pros and cons, and can be challenging sometimes to balance this. We don't have a very good way of controlling this disease in every patient. So some patients have a progressive disease. We're trying to find better ways to control it, but medications have their own limitations and they obviously bring their own list of complications. So it's a two-way traffic. I think it involves mutual respect. It involves establishing a comfort level between the patient and the physician. And I would say between the patient and their family and close loved ones and the physician, because it's a process that involves more than just a patient-physician relationship. What does your relationship cover? And as I said before, it covers lupus, but also what's associated with lupus. And I think finding time to focus on both elements is important. Sometimes it's important to focus on the active inflammatory aspect of lupus, and the associated things might take a back step or a back seat for a few visits. But then once the activity starts settling down, I always try to find ways to bring this to patient's attention and talk about other factors. Lupus involves clinical features, the patient's concerning symptoms, which may or may not be directly related to lupus, disabling symptoms and discomfort, and most importantly, the medications, the other treatment options, exploring and monitoring for disease activity. And associated with lupus is a much broader concept, but the big elements are the chronicity of disease and associated other conditions, the chronic pain that lupus almost invariably brings with it, and depression and other issues that may be associated with it. And things that we haven't talked about, like bone health, like immunization, like preventative workup, those are important things on our list to be considered also. So lupus, as I said, it's a shared decision-making process. It's very important to remember that you are the expert. You're living with lupus, and that means you have a long experience with this disease even before you were diagnosed. My decision-making process and what I recommend to everybody is that it should be a patient-centered decision-making, trying to tease out what is directly related to lupus and how medications would control that, but also trying to focus on things that the physician may not feel necessarily related to lupus, and how do we engage other providers or other resources to try to help with that. And I think that's very, very important. But in the end, it's the patient that is the center of this whole process. The patient should be able to make the decision after being informed of all the options, pros and cons, and next steps. It's important to understand lupus. The more you know, the better your outcome. And what is your lupus to you? Every patient that I see with a diagnosis of lupus has something unique and different. So lupus is not a single cookie cutter diagnosis that just works the same for everybody. Some patients have a certain set of symptoms, some have others, some have a more predominant pain concern, some may not. So trying to understand lupus in general and how it affects you, sharing it with your provider and understanding what may be directly related to lupus will also help set reasonable understanding of what to expect. So what is this medicine going to do for me and what it might not. One element I wanted to discuss, I talk about this with every patient I see who has lupus, and that is non-adherence to therapy. I do not use the word, and I do not appreciate the word non-compliance. It means something totally different. Non-adherence to therapy is a very common problem in lupus. And that doesn't mean that you are intentionally ignoring what the physician is saying or not taking your medicine because you don't feel like it. Most situations, it's a learning opportunity, at least for me, to understand the factors associated that you're unable to do things that were discussed and agreed upon. Is it that the disease is too much to handle? You have a new diagnosis, somebody put you on 5 medicines, you are really, really tired of all of this. Is it an overwhelming element that involves just the number of medicines? How do we address that? Is there an underlying depression? And you may or may not realize it, but your provider might be able to point this out. Or if you're not really sure what this medicine is doing for you. I have a lot of patients who question me over time. And sometimes over multiple visits what this medicine means for me. It's a good question. It's important to ask that every time you feel like you need more answers, because you're taking the side effects and risks associated with the medicine. It should be of good benefit to you as a patient to be able to improve your outcome, improve quality of life. And that is why I think it's very important to say, what is this medicine doing for me and why am I continuing to take it? Why the lifelong regimen? Because of the chronicity of the disease, but there are other factors that they can address for you. And there might be concerns like side effects. I've had patients who've been very nice trying to do things the way they were asked or discussed, but there were side effects and other things that they were hesitant to bring up at the initial visit. I think it's important for the provider to know about them. It's important for the physician to explore and tease out those ideas. So for all these reasons, when I look at somebody not able to do things the way it was discussed, it is not a blame game. It's more of a question of what is interfering with you being able to do this, and what are the underlying limitations or factors we might not have considered. There are multiple reasons for medication adherence. So you can see that it's not just one patient issue. Some of my patients that I've seen over the years feel like they're not being good enough as patients. That's not the thing, but sometimes you may not consciously or subconsciously feel that this treatment is needed. Sometimes there might be factors associated with affordability. So sometimes patients would not discuss, copay assistance and other options with their pharmacist. And after some time, they feel it's too expensive to afford. Sometimes there are side effects, like I mentioned. There might be some help needed to address things like forgetfulness, which lupus itself is a big factor in this. And then, how well you understand the disease, how well do you feel supported in terms of people who can help you with this or with other things so you can focus on your disease. And then, sometimes you are in chronic pain, you're being given this medicine that's supposed to keep the inflammation quiet, but the perception is that it's not really giving me the outcome that I need. So discussing why this medicine and what it's expected to do is very important. I think a big element is poor patient-physician relationship, because if the physician's not spending time talking about these things, you're really not getting the benefit of being followed and treated by a provider who can connect with you and help you. So reaching out, trying to connect is very important for both sides. And like I said, there are other people who are involved with this. Sometimes there are issues with chronic fatigue, with appetite changes, depression, psychological issues. Sometimes there are other specialists that might be needed for areas of the heart, areas of the lung, certain skin issues. Sometimes you might notice things associated with poor circulation, and certain medications that might be needed are prescribed by other providers. So it's a multi-step process, and it's also an involved process that involves other people also. And sometimes your rheumatologist might say, you need to continue to engage with your cardiologist or your pulmonologist. And that is not trying to brush away your symptoms most of the times. It is to, again, redirect you that this area needs an attention from a specialist in that field. Who are the important stakeholders in your care? So important to remember again, and I can't emphasize it enough, when you're checking in, when you're seeing a physician, it starts with the front desk. It goes with the MA. It goes by mentioning that you're not feeling well, or you have this issue going on, or I have a question about immunization, and they can sometimes discuss or mention to your physician, and that really helps. Medications you might need refills on. Sometimes you're overwhelmed with your symptoms and you might not remember to ask for it. So ahead of time, asking for this is helpful. Some systems have a dedicated nurse who understands lupus and lupus-related issues, and getting help from them. Certain pharmaceutical systems also have their dedicated nurse for biologic medications, for example. Engaging with them is helpful. And then specialists, as I said, they're trained in specific aspects of the disease. And that doesn't only include providers and consultants. It might also involve specific people for exercises, or talking to a counselor about low mood or depressed affect, whether or not it requires medication management. And sometimes diet can be a factor. But other providers like nephrology, neurology, cardiology, dermatology, these are overwhelming, but they are sometimes needed to try to get some help from the specialist who understands the organ system much better and is able to give their expert recommendation to sort of blend with everything else your rheumatologist might be doing. And it's can't emphasize enough finding people who've been through this journey. You will hear about some of these experiences later today, and that is very important because sometimes it feels like you're all alone dealing with this disease, and it feels unique, and it feels like nothing seems to work. And trying to get involved with support groups like the Lupus Foundation of Northern California and other systems can help improve your understanding of the disease. Try to find resources that you may not be aware of or you didn't think of asking, and looking for things outside medication realm of things that might work. Certain diets might help patients. Sometimes you might have specific social support concerns, and these things really, really help. They help control the disease from a non-inflammatory aspect, and that is a very, very important element to managing lupus. So, these are all questions that frequently come up, and addressing these are important. So, what all can I expect to see with lupus? And what it means to have lupus? What is my lupus? And what is the manifestation that I'm dealing with? The treatment options, what other options are available, reading on your own, asking your physician for literature, engaging with a nurse, and how do I monitor for things? What do I watch for in terms of this specific disease manifestation or complications? That is very important. And then, coordinating with other care providers and trying to get engagement through them is sometimes a challenge that needs work and dedication from both your physician and also the patient. This is a thing that one of my patients had brought up many, many years ago. And over time, I have talked about it. I have learned more from other patients. But a patient diary seems to be a very good help for patients. They can, you can use it the way you like, but the way I've seen it work the best is to have like a front of the diary summary page, which tells you what your specific lupus manifestations are. And having another page to say, these are the symptoms which the provider doesn't think are directly related to lupus, or things that are sort of in the gray zone and it's not clear yet. And then having a detailed part where you have a discussion with the provider, they say, change your medicine X to Y or increase the dose. Having that information to track for yourself, and also when you get home, not feeling confused or thinking about what you need to do next is very important. Symptom-specific aspects over time, what were my symptoms 10 years ago and how do I do with my lupus today? They are important to get an idea of timeline. Adverse events, issues with medications. I had a patient who used to keep it at the back end of the diary that these are the medicines I've tried and these are the medicines I'm having trouble with. And then other aspects, can it help me with adherence to therapy? Some patients like to create a check mark and see if you can look at different ways to keep a track of what you're doing, keeping a track of your appointments, your visits, when your next lab is due, when your eye exam might be due, having your provider information handy in case you need to contact them. They're all good things. And then what do you do to prepare for your visit? I always tell patients to review what they know about their disease. So how are you doing with your disease? How are you tolerating your medicines? What are the key concerns that affect you? And what are the one or two things in this visit that you want to discuss? What support, information, or resources will be helpful? Medication refills, the labs needed, and things that you might want to ask about. And then I would prioritize these and put the serious problem first, serious for you. It can be, muscle aches, which may or may not be a life-threatening problem, but it is an important problem. You're suffering with it. It's the top of your list. And then I would note that I'm going to discuss this issue today and see if there is any recommendation, help, or resources that might help me. Issues that affect your quality of life, they're very important to consider and discuss. So this is lupus and this is beyond lupus, and they are very important to look into both elements. At your visit, I always recommend people arrive early, bring a friend or family member if needed. Be focused on your intake questionnaire, note specific ideas or questions or symptoms that are affecting you, so as to make sure the physician also stays focused on those. They might have things of their own to discuss with you, your lab results, your concerning findings, things that might cause more damage over time. And then looking for, what help do you need before or after your visit? Medication refills, info to share like eye exam or another provider's visit and their contact info. And that makes things very easy to coordinate care and saves your time that is valuable that you want to spend with your physician. It's very important to engage my chart if you need help and need more information. But again, keeping it focused so your questions are addressed in a timely manner. During your visit, of course, it's important to listen to the physician, but make sure your appointment has me time. It's very important to have time that you want to address your questions with. Otherwise, it's a one-way street, and we talked about it, right? So what are your prioritized concerns? What are the focused areas you want help with? What are the other issues you might want to come back in some time to discuss? Or if the provider has ideas on who else could address it for us. After the visit, again, do you still have unanswered questions? Do you think making a sooner follow-up would help in a few weeks? Do you think seeing another provider would be of benefit? And then, did you get your me time? Or expressing with your physician that I had these one or two questions, now that the disease scary elements that you had concerns about are being addressed, I still need to have time to discuss these points as well. They are equally important. And then the next steps, do you understand why you need these things? Do you understand the medication and changes? And are you really okay with it? Are you feeling overwhelmed? Can we split it into more than one step, or can we take it slower if you're not comfortable? That's very important for me as a physician, because if you're going to agree with it, go home, feel overwhelmed, and not be able to adhere to the plan we came up with together, I have no way to find out unless you tell me. Again, the others, your lupus doctor might need to get more information, other specialists might be needed, especially in aspects of medication management, where clinical pharmacy and pharmacotherapy are good options. Managing depression is very important. Pain doesn't completely go away in lupus. So how well are you doing with it? And what else can be done to address that? And sometimes it needs more help and more providers to help with. So the key element here is really understanding your lupus, and understanding lupus in general. Using resources to your advantage, finding ways to help, considering support groups. Consider having this lupus diary. I found it to be very helpful for patients. And remember, it's a two-way street. So communication is key, making yourself heard and hearing out what the provider has to say. Preparing for a visit, it takes time, it takes effort, but it really helps. And then the others, how well do they work as a team? It's a team effort. It's not a one-person thing. So making sure everybody is working with you, your questions are being addressed, and complications or organ involvement is being addressed appropriately, and unanswered questions, of course. Do you need a repeat visit? Do you need to do a phone visit or a video visit to follow up on things? Those are important questions that you need to look into. So I know it was a long talk with a lot of information, but I hope it helped some of you, and I'm happy to address any questions or concerns you might have. And thank you for your time.
Thank you, Dr. Gulati. That was very interesting. You really covered a lot in there, and I think incredibly helpful for the lupus patients. Really, I think that's a great advice for anybody with their doctors, actually, not just lupus patients. So I'm going to open it up to questions, and everybody, you can type in your questions in the Q&A section, and we will read them off as we go. And if you'd like to ask anonymous questions, you are perfectly able to do that. You just click the anonymous button that's in the Q&A section. So we have our first question here, which is, I was diagnosed with lupus almost 13 years ago. Does lupus get worse when you get older?
Thank you for that question. It's a very important question to consider. And the short answer is yes and no. I know you were looking for a simpler response, but I'll explain it. Lupus is unpredictable, partly because we don't know how lupus behaves in an individual over a period of time. And a lot of it is written down in your genetics, unfortunately, and I have no way to assess it. Hopefully someday we do. The other part to it is, what does lupus do as it slowly smolders in our body? Like I said, we have no cure for lupus. So essentially, we're trying to control a disease by assuming that the blood work, that the history, that the clinical exam shows that you're doing well. And so in part, patients who respond really well to medications and treatments, and their lupus truly stays quiescent, they do fairly well. I have lupus patients who had a pretty severe course of their disease at onset, and they ended up doing fairly well. They were on their medications, adherent, had regular visits, and the outcome of that lupus has been really, really well. I just moved there from Northern California, so I feel sad having left my patients I treated for a decade. But they thankfully, many of them did really, really well. Some patients where they have a smoldering disease, or a disease that is uncontrolled, or a disease where the blueprint of the disease itself says, I'm going to be a severe disease, whether you like it or not. That is a subgroup of patients where we might continue to see damage. That can happen with each flare. So minimizing flare is very important. That can also happen over time. And that one of the best examples you can use is joint involvement or organ involvement, like lung involvement. Sometimes when you have that type of a case, it does tend to progress slowly or rapidly depending on the case. And there are three things that are very important to your question. One, staying adherent to the regimen as much as you can, because your provider will assume you're taking this medicine in this exact way. As much as you can, it will help them reassess that you're on regimen X, doing so and so, and that they need to change the treatment. If there is a doubt that you may or may not be doing it the way you discussed, it creates a problem. Second is limiting exposure to potential environmental or other factors that can trigger lupus or lupus flares. Infections can be one of them, certain viral diseases, and unfortunately, we don't have a way to completely prevent it. But as much as you can, smoking is a huge risk factor for lupus and other autoimmune diseases. So smoking is one thing I would tackle first head on if that is an actual issue. And that involves both direct and indirect smoking. So people should not be smoking next to you, You should not be smoking for starters. And then, trying to keep your established visit with your provider. As lupus sort of looks like it's quietened down, patients have a need, and understandably so, not wanting to see their provider every few months. I'll see you in 6 months. Yes, that's good. But it doesn't give me the opportunity to reassess your labs. Labs are not always required, but sometimes they may be. And reassess your symptoms. What might be a trivial symptom for you might be a trigger for the physician to say, you know what, this is a patient who's had long-standing lupus, was able to walk so many blocks, and now is not able to do that much. And that is a new change over 6 months or 4 months. I'm going to investigate more, or maybe seek help from one of our other providers. So it really depends on what your lupus is, but these 3 factors usually help quite a bit in controlling the disease in the long run. Great question. Thank you so much.
Great, thank you. Our next question is, I have lupus and I have 3 sons. Over the years, one of my sons has shown symptoms but hasn't tested positive for lupus. Can lupus be passed on genetically?
It's another great question. Even though I don't see you face to face, I can understand the anxiety this diagnosis brings. There's so much unknown about this disease. I can give you a perspective in terms of the genetic side of things. And there is in first degree relatives having lupus, the chances of having lupus is much higher, and actually higher risk of developing lupus with a lupus history than some of our other autoimmune diseases. So that's an undisputed fact, that your risk of lupus is there. To what extent, it really depends on what literature you look at. There have been studies looking at identical twins who were born to the same, with the same genetic makeup, who were assumably raised in the same environment. And yet the risk of one person developing lupus predisposing or relating the other twin to develop lupus is not 100%. It is in fact somewhere around the ballpark of 25 to 50% usually. So that's not as high of a number as you would expect. So I would say genetics is an important component. It needs to be kept in mind. It's not the only factor. And as we understand the disease better, finding ways to avoid triggers are going to be helpful. I published an article on environmental factors in lupus because I found it really fascinating what all can trigger lupus. And certain things are very difficult to implement in daily life. It's plasticizers, for example. I stopped microwaving things for a long time in plastic containers, but you can't really implement everything into your daily life that easily. So hopefully, as we find better evidence of preventative options and things, we will make progress and be able to give you a better idea of what the risk of a child or a parent developing lupus would be. But that's where the most risk lies, in the first family, immediate before and after.
Okay, great, thank you. We still have time for a couple more questions. So if you guys want to type in your question, now's the time. I had a question because I was a little slow. The Ask Me 3 Good Questions website. It was do you have that website by any chance that I could pop it in the chat?
Sorry, I'm getting old. I was muted. I put that on the slide, but I think I still have it pulled up. Let me share my screen so we can show it to you.
Okay, perfect. Thank you.
It's this website. This is called
perfect.
Ask Me 3.
3 good.
And this is just 3 good questions for your good health. It's a good question to ask because it helps with keeping things safe and keeping your care according to how you want. It's a good resource, and it really summarizes down to these 3 questions. So it's a good element to consider. Not the only resource, but something, I have a lot of experience in quality improvement and I've used it for other diseases. I find it applies to lupus also.
Great. I'm going to put that in the Q&A just so people can see it as well, or in the chat.
Sure. I can copy the link, actually. It might be easy.
Oh, I found it. Perfect. Thank you,
Okay,
Dr.
perfect.
Gulati. Yeah. Here's another question. I've been diagnosed with SLE about 10 years ago. I'm currently taking Safonella and Cyosporin. I'm concerned about taking cyclosporin long-term, as I've heard it causes kidney damage. What are your thoughts on this?
It's a good question. I can't comment on specific disease-related questions, so I'm sure your physician has a rationale for medication use, and cyclosporin is one of them. Frequently used for certain subsets of lupus, especially renal involvement. All these medication options, starting with hydroxychloroquine, which we sort of consider the very basic foundation of lupus management, and it's been there for more than 100-something years, almost more than that. Quinine in one form or the other, all the way up to biologics, which include injectables or infusions. They all have significant noted side effects and concerns. And that is not a stagnant value. It doesn't mean that you're taking hydroxychloroquine today, your chances of getting an eye involvement with that medicine is X amount. It changes over time. So I would say it's somewhere in the ballpark of maybe quoting a random number, 1%, but it changes as you're exposed to the medicine over time. Certain medications might have side effects that happen more initially and might subside over time. Cyclosporin is another agent. It does have toxicity. It does require monitoring. As long as you're being monitored and you're aware of the side effect profile of the medicine, which your provider can help you with, your pharmacist can help you with. Not only does it need to be considered in continuing the medicine or exploring alternatives, it also needs to be individualized, because certain side effects you may not think would be, things that you would like to undertake, a risk that you would like to take to get the medicine. And just quoting a bad example, people like to go hiking. Not everybody likes it. Some people, I'm scared of heights. I always feel scared walking behind my wife. So it's not really a medical question, but is this a risk I'm willing to take? And it's a different scenario, but we're looking at outcomes. So it's important to individualize it to your need and think about the pros and cons of it and how it affects you. Sometimes the medicine might be the only option because there are no other proven good options. And in that case, it's a difficult decision, but it depends on what your thoughts are.
That's great. And it seems like that the lupus diary that you were talking about would be a great tool to use for that, to talk about your symptoms and your concerns and bring it back up to your doctor in the future. Well, I think that's all we have time for today on the questions, but if people do have questions that come up, please feel free to send them to us at communications@lfnc.org, and we will try and get those answered for you. Dr. Gulati, we really appreciate your time today. It was such a good, useful information, and your expertise was really, really well received, I think, by everybody. And we hope we can have you as a presenter again